participants. And so when you click on that, then that should make me the only person that you see. And so if you guys aren't able to do that, please let me know. I can still hear you. So the audio doesn't get affected. But if you guys have struggling with that, let me know, or just put it in the chat, please. And then that should allow you to see our room a bit better.
Do we hide it or we take it out?
Take it out. So you're just going to hide it. So video settings.
Okay.
Yeah. Hide non-video participants. Did you see that?
Yes. And just, I selected it.
Yep.
Okay.
And then am I the only person that you see?
Yes.
Perfect. You did it right. Okay. So just kind of going through the names randomly. We don't have a big group to choose from, but some people that I've identified to hopefully try to participate in this. I'm going to list them here in just a minute, but if you don't feel comfortable or you don't want to, I totally understand. Just let me know that you're not, that you don't want to actively participate, and there is zero pressure for anybody on this. So Eliza Smith.
Oh, hello.
Hi. Dan Kinker.
Yep.
And then Angela. I don't know your last name, sorry.
I'm sorry, what?
Angela, yeah, we're going to have you, if you feel comfortable, have you participate in this verbally too. And then Orietta, did I say your name properly?
You did it very well.
So you guys, if you guys are going to be the providers that are asking your bedside people to intervene on this kid as you're able to, okay?
Okay.
Does anybody have any questions? All right, we are gonna, give me a second and we'll switch things around here, okay? What do you guys think?
All right, I'm muted.
I did.
There's a little feedback.
Yeah, is that better now?
Yeah, I'm not hearing it now.
Okay, thank you. Okay, so we're gonna go ahead and get started with the case. And feel free to ask any questions that you would want. So the scenario is a 12-year-old female presenting to the ER with fever, abdominal pain, and fatigue. She developed fever to 102 Fahrenheit, nausea and vomiting 3 days ago. The fever does improve with antipyretics, but has remained persistent. Parents note that her abdominal symptoms are improved, but noticed that she was becoming more tired and was eating and drinking less in the last 24 hours, which prompted them to bring her to the ER.
What are the other vitals?
Yeah, so we can get her hooked up to the monitor here. So your heart rate is 120, her respiratory are 26. Your blood pressure is 85/50. Can you guys see that on your monitor?
85/60, no, I don't. How old is she again?
12 years old.
Now we see it, okay.
Would you guys like any other information or? You guys can ask anything that you want, ask us to do anything you want.
Okay.
Yep.
What is her
Does
general
it-
appearance?
What is the what class?
What's her general appearance?
Yeah, she is. She's sleepy, but she awakes to verbal stimuli. When you listen to her, she sounds clear, no increased work of breathing. She is tachycardic as evidenced by her vitals. No murmurs appreciated. She has 1+ peripheral pulses and slightly cool extremities. Her cap refill is 3 seconds. Her abdomen is soft, mildly tender. She does have some conjunctival injection that's appreciated and cracked lips with a diffuse erythematous rash on her abdomen. Her temperature is 38.5.
Has she been vomiting? I know there's poor PO intake and any diarrhea or black or bloody stools and any recent respiratory illness or, ENT symptoms like sore
Yeah.
throat too.
She had a cold about a month ago, but otherwise nothing obvious.
Is,
Oh, guys, I think we just lost video. We'll get it back. And then she had the vomiting, no diarrhea or bloody stools, and then hasn't been sick here.
is her vaccination up to date?
Her vaccines are up to date, yes.
Does she
Right.
get vaccinated for COVID?
She did not get vaccinated against COVID. Mom and dad both had COVID about a month ago, but she never developed those types of symptoms and was not tested.
And then any urinary symptoms, I guess, would be kind of last, maybe important.
No pain on urination, has maybe had slightly decreased urination in the last day.
And this
Any
was a
pa-
female, right? Have we had menarche yet?
Female, no menarche.
Okay.
Any medical history on that child?
She has no allergies, no prior medical history. And yes, and up to date on vaccines except for flu and COVID. Her last meal was yesterday and had some water this morning.
And
I
I
think we
assume
need a-
she's on,
Go ahead, Gerard.
I assume she's on no medication.
No meds.
Well, I think a point of care glucose would be good as well as, the vital signs are concerning for a 12-year-old. We should have kind of getting close to adult vital signs. So be concerned for shock with the cap refill and everything. So be 2 large bore IVs if able and start at least a 10 cc or 10 to 20 cc per kilo bolus. I don't know how much kiddo weighs of IV crystalloid and draw blood cultures and get a urine and CBC, CMP, CRP,
ESR.
ESR, MAG, urinalysis, I said urinalysis, chest X-ray.
I'm trying to get an IV access here. Looks like I'm hitting the valve. Just last second to try again. Oops, just slipped out. Right, I'm gonna try one more time to get an IV access in.
Getting the blood glucose that you requested, putting it in the glucometer. The blood glucose is 98, doctor.
All right, I just got the IV in. We have an IV access. Right.
Can we recycle blood pressure and update vitals after our fluid bolus starts?
First. The pump is recycling.
Can we also swab her for the flu and COVID, please?
For sure, yeah, we can send this web right now.
So it looks like the bolus hasn't done yet. Did you want to do that? So I'm just going to give the bolus. I'm going to do this swab for COVID.
Other things I didn't mention were lactate, we could get a VVG as well.
The first bolus is N, that is 20 per kilo.
And
Swab
Can-
done, we're sending,
can we give acetaminophen? Is she vomiting or she's not?
Not right now.
Okay.
Your
Can
gas
we-
came back. Oh, go ahead.
Can we give her something for her 10, some acetaminophen PO, please? And 10 milligram per kilo. How much does she weigh?
40 kilos.
Okay.
Your VBG is back. pH is 7.29. CO2 is 48. PVO2 is 35. Your bicar or your deficit is -8, and a lactate is 3.2.
Acetaminophen is N.
So your patient is becoming increasingly somnolent. Airway is still patent, but starting to have some increased work of breathing.
What is her pulse ox at this time?
should be on the monitor right here, it's 98%.
Did we get the chest X-ray result?
They are on their way.
Thank you.
We'll get an EKG as well, and this might be a decent time for like a point of care echo or something if we're kind of concerned about the. I don't know if there's any peripheral edema. I don't think I remember any of that, or facial edema.
No edema is appreciated on exam. However, after listening to her after the first fluid bolus, you notice that there's crackles and some mild hepatomegaly that's developing.
Yeah, I'd like to add on a BNP to the labs there and troponin. I think I know we're waiting for that it was kind of a tiered approach that we were talking about earlier with labs,
Yeah.
but maybe start adding on things like D-dimer and
Ferritin, maybe
ferritin levels and
PT and PTT as well, INR.
Yeah, we just got the APG, only showing sinus tachycardia here. Can I get some more labs as well?
And chest X-ray shows diffuse haziness bilaterally, but nothing focal.
Let's check all these labs. All these labs have been sent.
I do wonder if like a high flow nasal cannula would benefit for now. I mean, I don't know if
All right.
looking back and diuresing the patient with the possible pulmonary edema would be the right way to go, but I think some broad spectrum antibiotics would be good at this point too. So we can do like 1 to 2 milliliters per kilo.
The patient is on oxygen.
We're ordering those antibiotics.
I'm having trouble seeing the monitor at this point. What's her last blood pressure and heart rate?
Your
Is that-
heart rate's 154, your sats are 83, and your blood pressure is 79/46.
Oh,
Anybody else want to just go straight to pressors for that blood pressure?
yes, that
I
was my
agree.
thought.
Yeah,
yeah, that's my thought.
yeah. Epi or norepi at this point.
Can I get more epi? Starting some epinephrine here.
Did we get any of the labs back?
Your CBC is, your white count is 18,000, your hemoglobin is 9.6, your hematocrit is 24, your platelets are 102, your CRP is elevated at 8. The electrolytes, your sodium is 132, your potassium is 4.9, Chloride is 98, CO2 is 20, B1 is 33, and creatinine is 1.1.
And just to start with some FD infusion at 0.02 per deciliter.
And what's the mental status at this point?
She's getting more and more somnolent. She's not responding quite as much to simple stimuli as she was earlier.
What is her GCS?
A 5.
And what is her saturation of oxygen? I have a hard time to see the monitor too. Is it 82 there? Do I see it right?
Yes, it's 82%, and she is on face mask oxygen at 10 liters, 100%.
At 32, okay. 32 breath a minute there. So I think we have to set up to either intubate this patient.
Okay, we can get a bag mask ready.
Back BVM for now and help assist ventilations, 100% FiO2.
All right, I'm gonna set up my bag mask here really quick. Mask. The intubation supplies ready here. Would you like me to draw any meds before we intubate, doctor?
Have we given any steroids yet?
What size? What was the question?
Yes,
Okay.
I have.
Okay.
Go ahead.
Pre-medications, we could do Versed, like 0.1 mg per kg. So like they were 20 or 40 kilos. So like 4 milligrams of Versed and trying to think of what fentanyl I would dose at.
Probably 25 would do.
And succinylcholine at 1.5 milligrams per kilo, 60 milligrams of succinylcholine for side intubation.
I have these medications ready and drawn up. And then, any size EPQ do you prefer, or?
What was that?
It's size of 5.5.
Okay. I'm gonna go ahead and administer these medications. Giving Versed.
So I think she could probably, I mean, she was 40 kilos. She could probably take a larger, I guess, yeah, 5.5 or 6, whatever. That would work, yeah.
Versed
And-
RN. You're gonna go ahead and give succinylcholine as well.
Is saturation going up with the bag mask, or she's not? The saturation is still at 82?
Saturations are up a little to 88, 89.
And how's the blood pressure here? Do we need to do any push dose pressors or increase the pressor?
Blood pressure, is about the same, 90 over 52. So some response to your pressors.
Are you ready for us to intubate, doctors?
Yes. Yes, go ahead and intubate. Well, if saturation is 89, can you bag a little more?
We will bag more.
Do you get any increase in saturation?
And we can go up to, I think,
90,
Sure.
90.
in we could do 0.4 mics per kilo per minute of the epi as well.
Okay,
Taking the epi up to 0.04.
Okay, we can go ahead and intubate now.
EQ is N.
Do we have good breath? Leave you finish. Check for breath sound afterwards, please.
You may listen.
I got the work listen here. I have equal breath sounds, right and left.
Okay. And just have a chest X-ray to check placement.
For a chest X-ray.
Mhm.
Your chest X-ray shows that your ET tube is in appropriate position and still has the increased vascular markings and now showing mild cardiomegaly. Okay.
Is the echo that was ordered earlier done?
They're on their way. They were busy in the NICU.
Thank you.
Okay, so can you guys see your vitals?
Yeah, we have better vitals now.
Okay, I think we're gonna pause here. If you guys can turn on your video. I know I'm putting you on the spot.
Uh,
I don't have video on mine.
Okay, that's okay.
how do I turn on? Yeah, I'm trying to turn on my own video there.
Okay, that's okay. You should be able, there should be a little camera where you change the settings to be off. You should just be able to click that and it should come on automatically.
So I click on this setting and video and always display name, mirror video.
Oops. You should just be
I
able
don't know
to,
if,
that's okay. You should just be able to push the video, the camera itself, just click on that and then it should turn you on, but it's okay if it's not working.
it's not working.
Okay, that's fine.
Sorry for that.
That's okay. Thank you guys so much for participating. I know it can be awkward in doing these in general, and then of course we're doing it virtually. So I really appreciate your participation. How did that feel to everybody? Well, I guess before we get started on that, what can somebody tell me in 10 words or less what was going on with this kid?
While he was in shock.
Mm-hmm.
And there's a suspicion of having a post-infection immune response.
Yeah, I'd be concerned about a myocarditis with cardiogenic shock mixed picture.
Yeah, I agree. I think that that's a great summary for what was going on with this kid. In today's day and age, of course, we're worried about MISC, but before 2020, that wasn't as much of an issue. So, and we'll see how it goes in the next few years. How did that feel to everybody? Awkwardness aside. What do you guys feel like what do you feel like went well?
I feel like we appropriately recognized where we made a turn to recognizing, you know, that, oh, there's pulmonary edema and things got worse after the fluid bolus. I wish I wouldn't have waffled between 10 per kilo and 20 per kilo and would have just started with 10, but I don't know, maybe she would have gotten worse either way, but.
Yeah, I think it's so hard in those situations. You know, I mean, the typical trajectory for shock is 20 per kilo. And so you never know. And that's why we just have to make sure that we listen to them again after we administer any bolus, whether it's 5 to 10 per kilo or 20 per kilo. So I wouldn't necessarily say that that was inappropriate in any way, shape or form. But recognizing exactly like you said, that things had changed. And so maybe being a little bit more cautious about the fluid management and going straight to pressors was exactly the right thing to do in that instance. You guys did a great job communicating what it was that you wanted, recognizing where you wanted to go. The labs wouldn't have come back that quickly, so that's why you didn't have all of the labs back with you. Sorry, go ahead. But the ones that you did have available to you, I think you intervened on and addressed it appropriately. Wanted to ask about the medication choice for intubation. Why did you choose Versed, fentanyl, and Sux?
So I wanted to choose something that I wanted to avoid etominate based on our discussions today. Ketamine, I was thinking to avoid ketamine because the heart rate was at 150. I didn't want to make that jump up to 180 or something, and I didn't have an EKG yet either. To if I'm going to induce a dysrhythmia, so went with kind of standard benzo and opiate choice there. And then succinylcholine, it's kind of a mid-range age kid. I wasn't suspecting any reason for hyperkalemia or no previous neurodegenerative disease or anything. So short-acting paralytic felt reasonable. Could have gone with rocuronium too. But I don't know, just felt like it was kind of middle of the road, kind of avoiding ketamine for the heart rate, avoiding etominate for the possible underlying sepsis.
I think that those are very well thought out. I think the Versed is the only one that I probably would have been hesitant on doing, just because she already was hypotensive and we were worried about her hemodynamics in that way. And then the fentanyl, I think is completely appropriate and reasonable. We still probably would have done 1 per kilo, 1 to 2 per kilo on her. So 40 to 50 mics per dose and then repeating it would probably, I think, still have been really well tolerated and hopefully gotten you adequate sedation for that. My caveat is I'm pediatrics, I only do pediatrics, and so we get really nervous with succinylcholine. And so in this instance, especially with the potassium that's back at 4.9 already, I probably would have stayed away from it. But if, at least for us, for example, some of our paralytics are not easily available and we have to get it from somewhere else, and if I'm worried about intubating and what I have available is succinylcholine, then yes, that's what I think using the medicines that are most easily available is the right thing to do. Let's see. Otherwise, I thought it went really well and your management was good. Does anybody else have any thoughts or feedback on anything with the simulation or how it went?
So fentanyl alone with the 0.1 per kilo would be or 0.1 to 0.2 would be adequate. Is
1 to 2, not 0.1. Yeah, so 1 to 2 mics per kilo. Yeah. So we probably would have. I probably would have done 50 and then just had several doses of the 50 and seeing if that had gotten me to where I need it. Obviously, with fentanyl, 2 to 5 mics per kilo is really what we're trying to what you end up needing. But on a child who's already somnolent and on their way to with a GCS of 5, you might get lucky and just get away with 1 or 2 doses of the 1 mic per kilo. So, and then if I did end up feeling like I needed something in addition to that, and I chose to use Versed, I'd probably end up on the smaller side of the dose and maybe do 1 to 2 milligrams total, even though her weight is big, appropriate for that dose. Just with her blood pressure concerns already, I probably would have erred on the side of the slightly lower dose.
okay.
Any other questions or thoughts about this scenario?
Would you have stayed away from ketamine?
Not necessarily. I think it still probably would have been a reasonable choice. Just understanding what I would be worried about. But I think I probably would have, if I did it, would have probably done the 0.5 milligrams per kilogram dose instead of the 1 to 2. But I think I probably would have stayed largely with the fentanyl.
Thanks.
Did you add anything? Anything? Okay. Thank you. Well, I appreciate it, you guys. Thank you so much for participating. If you guys have any questions at all or thoughts, we'd love to hear about it. This is only our second time doing it, and we tried something different with doing it this way. And so any feedback that you guys have about the simulation, which of course is virtual, please let us know, let Tina and Cody know, so that way they can give it back to us, because we'd love to improve upon things as much as we can. So if you guys don't have any questions, then we'll plan to take a break until 11:15, and then that should automatically put you back in the main room.
Thank you so much.
Thank you.
Thank you, guys.
Thank you. Sarah Haskell said that as an observer, everything went very smooth and lifelike. So congratulations, you guys did an excellent job.
Thank you so much.